Alrighty, here we go. This is Dr. Jenkins, and this is the first of two videos I'm going to record as a review. So, in lecture, in person, we've gone over the muscular tissue, and there's a lot to cover. So, in this first video, I just want to review the anatomy, and in the second video, that's when we'll go through the steps of muscle contraction. All right, folks, here we go. Okay, so as we did in lecture, I prefer to start with the whole skeletal muscle and then go from big to small. So remember that we're focusing on skeletal muscle. We have the whole skeletal muscle. The outer covering of the whole skeletal muscle is called the epimysium or epimysium. I say epimysium. That's the connective tissue covering over the whole muscle. When we start to break the skeletal muscle into smaller and smaller pieces, if you look at the whole muscle and we have a cross section, we have these. What color can I use here? Let's use red. Well, no, because the muscle's red. We can't use red. Let's use blue. So we have these circular compartments. And each of these circular compartments is called a fascicle. When we pull out a fascicle, we have many muscle fibers. I gave the example in class of an electrical cord if you cut it if you cut into it, or I gave the example in class that if you take a whole bunch of raw spaghetti pasta and you wrap it in saran wrap. Well, the whole thing is the muscle, and then you have these groupings called fascicles, but each individual pasta piece is a muscle fiber. So even in the fascicle, we can see there's one muscle fiber, there's another, there's another, there's another. So we have the whole muscle made up of these circular groupings called fascicles. Each fascicle is made up of a bunch of muscle fibers. If we go even smaller, we see that each muscle fiber is made up of a bunch of myofibrils. And then lastly, of course, we have, let's go with blue. Lastly, we have the myofilaments. Each myofibril is made up of the smallest structural unit of muscle called the myofilaments. Okay, so from big to small, the whole muscle has these circular compartments called fascicles. Each fascicle is made up of muscle fibers. Each muscle fiber is made up of myofibrils, and each myofibril is made up of myofilaments. The myofilaments are the smallest pieces of muscle, and more importantly, these myofilaments are the contractile pieces. So when a muscle contracts, it shortens, and the pieces that are actually shortening are these myofilaments. We have two myofilaments. The thin one is called actin, and in class I told you that the way that I always remembered that is because actors usually are skinny, because we're in a superficial society, stupid. But I think of an actor act thin. So the thin myofilament is actin, and the thick myofilament is called myosin. We talked about two little subunits on actin. So our two little subunits on actin are called troponin and tropomyosin. You'll see these spelled with either an O or an I, and either one is okay. Okay, so the smallest pieces are the myofilaments. The thin is actin, and the thick is myosin. Actin, the thin myofilament, has these two smaller subunits called troponin and tropomyosin. All right, good. We also talked about, let me just continue here. We talked about the fact that the actin and myosin are arranged in this pattern. So if you look at actin and myosin, we have thin ones that kind of look like that, and then thicker ones in the middle, right? So in this drawing, we would see that the thin is actin, which is green, and the thick is myosin, which is blue. But the idea is these myofilaments are arranged into these horizontal units. Each horizontal unit is called a sarcomere. Horizontal unit of actin and myosin. I think that's a better definition. So microscopically, the actin and myosin are arranged in this little horizontal unit or pattern. And each one of those little units is called a sarcomere. It's a horizontal unit of actin and myosin. So in the green rectangle, we see one sarcomere. And of course, right next to it would be another sarcomere. So these are just successive sarcomeres. And you can see in the picture on top of the myofibrils, we have one little sarcomere next to another, next to another, next to another. This is important because when we talk about the steps of contraction, we're looking at each individual sarcomere. So the steps that we're about to talk about in the next video of how the muscle contracts, we're going to be looking, taking a window microscopically into a sarcomere. And within that sarcomere, those myofilaments are going to slide past each other. Sliding filament theory. Muscle contracts, muscle shortens. So if this happens at each successive sarcomere, then the entire muscle is going to contract. The last thing that I wanted to remind you of, and these are just more pictures that you can use, the last piece of anatomy to talk about is what's called the sarcoplasmic reticulum. So we're looking at the myofibril. So each one of these is a myofibril. There's a myofibril, there's a myofibril, right? Well, each myofibril has this sleeve covering it called the sarcoplasmic reticulum. Sleeve that surrounds each myofibril. And it looks kind of like a mesh sleeve. I'm not sure if that word makes sense to you, but it's not, in other words, it's not just a solid sleeve. It's not like that. Instead, it kind of has that mesh-like pattern, okay? So part of that sleeve is here, here. It's this blue sleeve. So it's a sleeve that surrounds each myofibril, and its function is to store calcium, because we're going to need calcium when we get to the steps of muscle contraction. All right, folks, that's a good review of the anatomy. Make sure that you know this anatomy first. It's going to make your life a lot easier when you go and try and learn the steps of muscle contraction. I'll see you next for that video.